Kia ora, te whānau. Welcome to the first ever HFNZ educational webinar. This is a momentous occasion, and so I hope you all enjoy it. Today we are talking to Abhi Tikkisetty, who is a physiotherapist and works out of the Waikato District Health Board. But first we'll do a bit of housekeeping. We're recording this today, and so I'll be making this available on the website sometime in the next little while, once I figure out how. There's also a survey to complete that will pop up at the end of the webinar and also turn up in your email. It's only 3 questions, and really it's to help us plan for the next webinar. Abhi will be taking questions at the end of this. We'll take these via chat. So if you click on your chat down the bottom there and enter your questions in there, I'll keep an eye on that and we'll put that to Abhi at the end of his presentation. So without further ado, I'll cast over to Abhi Tikkisetty, and he will talk to us today about joint health and physiotherapy. Abhi.
Hi, thank you so much, Phil. Well, good evening, everyone. Thank you for joining us tonight. So just like what Phil said, my name is Abhi Tikkisetty. I'm a physiotherapist. I work in Hamilton at Waikato District Health Board with the haemophilia team. So tonight's presentation is about the role of physiotherapy in helping people achieve good joint health. So I'm hoping with this presentation, I can give you some ideas, some little tips, some tricks you can take away with you and start implementing this as part of your journey of recovery. So yeah, just like Phil said, please feel free to ask questions. I'll try my best at the end to answer them. So everyone can hear me for a start, just making sure everyone can hear me. I will share my screen. All right. So yeah, the presentation tonight is about the benefits of physiotherapy for joint health and haemophilia. Now, before I actually start this presentation, I have a small quiz. And here is the question to the quiz. Can anyone name me the name of the single medication that has been clinically proven to help with all of these conditions? So this single medicine can help reduce blood pressure, it can help reduce cholesterol, it controls diabetes, it reduces the risk of heart attacks and strokes, but more importantly for our haemophilia and bleeding disorders people, it can actually help with joint health and improving their joint health. Does anyone know the answer? If you have thought, or if you think the answer is exercise, you're 100% right. Exercise is medicine. And if you wish, what you can do is you can replace the word exercise with the word movement. Movement is medicine. Or you can replace it with the word rehabilitation. So rehab is medicine. If any of you have ever worked with physiotherapists, maybe from overseas, sometimes they call themselves physical therapists. Again, it's the idea of physical movement and the therapeutic effect of exercise. And so really my presentation tonight is going to revolve around this idea, the benefits of exercise for good joint health. So I'll be talking to you about different types of exercises, different strategies, how best to go about them to maintain a good joint health and good joint function. So for us to understand good joint health, we need to understand a little bit of the anatomy. And I'd like to share with you 2 key words. It's probably words you already know, but the first word is cartilage and the other word is synovium. Now, if you look on the screen here, you'll see a cartoon diagram of a knee. And the white structure that you see in the knee is the cartilage. And I would like you to think of the word cartilage as a shock absorber. It's designed to absorb shock. So every time you walk and every time you make, every step you take, your cartilage is absorbing all the shock. So you need to think of your cartilage as a shock absorber. The other structure is your synovium. And your synovium is what helps to lubricate the joint. So think of it as a structure that releases a bit of oil. So if you think about it as an engine, you have multiple moving parts in an engine, and what helps to keep that engine running smoothly? It's your synovium. So for good joint health, you need a good amount of cartilage and the synovium to be working effectively so that the joint functions in a good manner. Now, as we know, people with haemophilia or other bleeding disorders, they will bleed into a joint. And this is not a favorable thing. We do not want blood in a joint, because when you have blood in a joint, it's actually quite toxic to the cartilage in the synovium. It breaks down the cartilage. So I have a short video here that I'd like to play. It's a video that you can find on YouTube, and it's from Novo Nordisk. And they talk about what happens when a person has blood in a joint. So it's only a couple of minutes, but I'll pause it in the middle just so that we can take out the key points. But I'll start now, and it's about an acute bleed.
Acute bleed. Joint bleeds can occur spontaneously or be caused by an injury. You can see the blood beginning to leak into the joint space. The bleed should be treated quickly, ideally within 2 hours. In case of delayed treatment, the synovium becomes inflamed as blood accumulates in the joint space and the joint begins to swell. As the blood accumulates, the body attempts to break down this blood to remove it from the joint space. The blood is broken down to waste products and iron. This waste and iron that are left behind is toxic to the cartilage, synovium, and bone. If the bleed is not treated quickly or adequately, the bleeding continues and creates an enlarged, painful, and eventually immobile joint. If this were the only bleed, the synovium would be able to reabsorb the blood over time, and the joint would heal. However, repeated bleeds into the same joint cause a vicious cycle. And each time a bleed happens, the waste and iron accumulate in the joint, causing further damage and immobility. Some of the iron and waste products are left deposited in the joint space. This damaged joint is then more likely to bleed.
So I'm just going to pause the video there for a wee moment. So what was the key, I suppose, messages in that? I mean, first of all, if you have a bleed into the joint, it's an unfavorable thing. The joint swells up, it's a lot more painful. But the message there was that the blood is actually quite toxic to the cartilage. So it breaks down the joint health when you have blood in a joint. And that's the reason why, as medical providers and as physios and doctors, we want to try and treat it as quickly as we can. Now, if you have a one-off bleed, it's usually okay. The body can resorb it and you can go back to a normal level of function. But some people have multiple bleeds. You may have heard of the term target joint. And so when you have multiple bleeds into the knee or any joint, over time, this will start to wear away at the cartilage and inflame the joint. So it can no longer function effectively. And sometimes you will have permanent, long-lasting changes into that joint. So I'm going to finish off that the YouTube video now, and it will talk about now what happens when you have repetitive bleeds into the knee.
Over time, the repeated bleeds cause chronic inflammation that has lasting complications on the joints. The accumulated waste and iron are toxic to the cartilage, bones, and synovium. As a result, the synovium thickens and grows tiny finger-like projections called microvilli. The synovium, with its small finger-like microvilli, are now more prone to getting pinched between the moving bones, resulting in a bleed. This early stage of joint damage, where there is inflammation, is called synovitis. As a result of this synovitis, the synovium no longer functions correctly. Thus, it is unable to lubricate the joint properly or remove the blood from the joint. Blood also has a toxic effect on the cartilage and prevents it from repairing itself. As this happens, the joint may form bony cysts with a loss of bone mass, leading to further pain and immobility. With repeated uncontrolled bleeds, there is more damage to the synovium and cartilage until the joint is unable to move. It resembles a crippling type of painful osteoarthritis, and the damage becomes permanent.
Righty. So again, just to recap that main point, blood in a joint is not a good thing. It's an unfavorable thing because the blood will start to break down the cartilage. And when you have repetitive bleeds, it can actually have permanent changes in the joint. So most of you, as you know, in terms of treatment, if you've had a bleed, again, I'm not going to spend too long on this because the point of this presentation is about joint health and the physiotherapy. But if you have a bleed, the first thing that you should be doing is that you should infuse your factor. The quicker you're able to deliver your factor, the less the blood will leak into the joint and the less damage you will have into your joint. And this is where having that good relationship with your haemophilia center is important, because the nurses and doctors and physios can guide you on what to do if you do have a bleed. And remember, if you have a bleed, for example, if you've bled into a leg, the important thing that you must do is you must take the pressure off that joint. So if anyone has had a bleed in the past, you may have been given crutches. It's because we want to take as much pressure off the joint so that the joint has the chance to heal and get rid of the blood. Because if you start walking with blood in a joint, you actually increase the risk of the damage or increase the chances of that cartilage breaking down a lot faster. So, and that's the same for upper limb. If you had a bleed into your arm, it's important that you take a sling and just rest your arm in a sling. Again, you're preventing that unnecessary extra movement. So, let's say someone has had a bleed or you've had a bleed, but now that bleed's gone, you can feel that the joint is starting to come back. Things are starting to feel normal again. Do you need to see a physio, or can you just go back to the things that you used to do? Well, the answer is yes. Yes, we do want to see you because physiotherapists can help quite a lot after a bleed. And I've put two key points up here. And the first point is physiotherapists can help return the joint back to its normal function. Has anyone noticed if you had an injury or a bleed, and it's many weeks or many months down the track from it, but that joint and that legs or the arm still doesn't feel right? And partly that's because muscles have not regained their natural strength around that joint. So you may feel like you can walk again, you can go up and down stairs and you can cycle, but you still don't trust that leg or you still don't trust your elbow. And partly the reason is because muscles have not regained their full 100% strength. And I'll actually be talking about muscle strength pretty soon. But the other reason that we want to see you is that we want to make sure that you do not have another bleed, that you're not going to rebleed. So we can put in some strategies in place so that the risk of a second bleed is decreased. So prevention is really the best treatment. And I want to introduce you to this chronic injury cycle. And what we'll do is we'll start with the picture in the top right-hand corner. And that's the injury. That's probably the time you hurt yourself, or that's the time you've had a bleed. And if we go in a clockwise direction, what's the first thing that all the doctors and all the physios will tell you? Make sure you don't move that joint. Try and protect that joint as much as you can until the bleed stops. And what happens when that is happening is that you're losing your muscle strength, and also blood in a joint inhibits how effectively a muscle works. So once the bleed is all gone, your muscles are actually in a slightly weakened state. And because you're deconditioned, the risk of an injury actually increases. So when you try and go back to doing the things that you used to do, chances are if the muscles are weak, you may re-injure that same structure. And unfortunately, that's how that cycle repeats. So you might have another injury, and because of that injury, you're having to protect that joint or protect that area. And because you're protecting it, naturally things are going to get a little bit more weaker. And because things are getting a bit weaker, there's an increased risk of another injury. So as physios, we come in this cycle and we help in all the areas in the cycle, but we try and help a lot more in the area of building your muscle strength, making sure that the muscles are nice and strong so that you do not have a repeat injury. So that's what we do. We try and help people regain muscle strength and muscle control. And this is really the key for joint health. And I've got a question on the screen. How strong are you, or how strong are your muscles around your joint? So if you have had an injury, whether it be a bleed or just a sprain, and it still feels a little bit vulnerable, you still don't trust that shoulder, or you still don't trust your knee or your ankle, think about this. How strong are your muscles around that joint? Because chances are, if you've lost muscle strength, that's the reason it still feels vulnerable. Remember, muscle strength provides stability and provides control for that joint. So that's really what we do as physiotherapists. We are here to help rebuild your muscle control and your muscle strength. And we do this through a very graded, systematic, methodical, regular strengthening program. And so again, I know I'm repeating myself here, but this is the key message that I really want to share with you. How strong are your muscles around your joint? And how much control of those muscles are they in good control or good quality? Is because the stronger the muscle, the less likely you'll have a bleed. The weaker the muscle, the risk actually increases. So I want to spend a bit of time now actually going through some different exercises that are quite useful. And you can actually start on some of these exercises if you feel that you can do them in a safe manner. But I do want to say this, please do link in with your local physiotherapist or your local haemophilia physiotherapist so that we can try and tailor something that's very specific to you. So it's very clinical and very, the right types of exercises for the condition that you have. So the first exercise I've put up here is hydrotherapy. Now, I'm a huge fan of hydrotherapy. If we break the word down, hydrotherapy, hydro being water and therapy being the treatment, it's treatment that's done in water. And the advantage of this is when you're standing in water, you feel a lot lighter. You've taken gravity out of the equation. Because remember, the biggest reason why joints hurt is actually because of gravity. Gravity puts quite a bit of pressure through our joints. If anyone's had a sore knee or a sore hip or a sore ankle, have you noticed that it actually hurts a lot more when you are going up and down slopes or up and down steps and stairs? And that's simply because when you're going up and down steps and stairs, the pressure that you put through the joint increases by double or even triple your weight. But when you're standing in water, you feel a lot lighter. So if we have a look at that picture on the top left hand of your screen, this shows you how much pressure of body mass is offloaded depending on how deep you're standing in water. So if you're standing at approximately knee height, you've taken around 15% of your body weight off. If you're standing approximately stomach height, you've taken half your body weight off. And if you're standing at maybe shoulder height, you've actually taken 3/4 of your body weight off. And that's the principle of buoyancy. When you're in water, you feel a lot lighter. And then you can use the resistance principles of water to try and strengthen your muscles up. So it could be something as simple as walking in water. So when you walk in water, it's the resistance of water that hits you that's now helping to strengthen your muscles. And you could try things like walking backwards in water. So you're now targeting different muscles. You can find a particular spot in the pool and walk sideways along the width of the pool. So you're now working on muscles on the right side as you push through the water, and that's the same for the left side. A lot of hydrotherapy pools will have flotation devices. So you might see noodles or dumbbell floats. And again, what you can do is you can use these flotation devices to create more resistance so you can work specific muscles, whether it be for your shoulder or for your elbow or for a hip or a knee. So yeah, I would encourage a lot of people, if it's safe to do so, that, maybe try and visit a local hydrotherapy pool, obviously once lockdown is over, and try some of these little exercises. Now, just a couple of things about hydrotherapy. It's not swimming. A lot of people, when I suggest the idea, would you like to do hydrotherapy? People automatically think it's swimming. You don't need to know how to swim. You're just standing in water because you're taking physics to your advantage by taking the pressure off and then using the resistance of water. Now, hydrotherapy pools are heated. They're heated to approximately body temperature, 35 to 37 degrees. But you can still do them in an ordinary pool as well. It's just that it's a bit cold in an ordinary pool. Now, I strongly feel gym-based exercises are really good. And I want to say this right from the start. A lot of people are reluctant to go to the gym because people think that when you go to the gym, it's all about getting big and bulky and strong and trying to look like Arnold Schwarzenegger. That's not really our intention of going into a gym environment for people that we want to help improve their joint health. The reason why I mentioned gym environment is because when you're in a gym, you can use the resistance exercises of machine weights. So we can start at a very light or very comfortable weight and practice doing exercises such as for your arms. So we can hold on to a handle and practice working on building our upper body strength. If we need to work on specific leg exercises, again, we can use specific machines to try and work on lower body weight. And the advantage of a machine is that they have a certain direction that the machine moves. So if you're completely new to a gym environment, it's still a good place to start with a machine because they usually have one direction that the machine can move. And so I think machine weights are a good place to start. Again, if you're not having a bleed, remember, we're not doing this during a bleed episode. We're doing this in the time that there is no bleed in the joint, no blood in the joint. And so my advice to you is that try maybe a little bit of machine weights. And again, try light weights. We're not trying to lift heavy weights. That's not our objective. Our objective is to help rebuild strength. And again, I'm saying this, link in with your physiotherapist because there are a lot of exercises that your physiotherapist can provide you that is safe for you and effective, so it is beneficial for you. Now, some people don't like to do exercises outside, and that's completely fine. And so this is where, again, physios can help with exercises that you can do inside your own home. So we could use equipment that you can just do in your own living room. And I'm a huge fan of Theraband exercises. I don't know if anyone's actually played around with Therabands before, but Therabands are these elastic bands, and we use the elasticness of the band for our resistance purposes. So if you look on the screen, there's a cartoon diagram of a person doing a bicep curl. So he's now strengthening up his arms, but he's using the elastic properties of the band to specifically work on his arm strength. If you have maybe a weak ankle, you can use the band to, again, work on specific muscles around your ankle. If it's the whole leg, again, you can do very specific movements and targeted exercises that will help strengthen up different muscles. So again, the Therabands are quite useful. They come in different colors. So yellow is quite light, and then you get up to a red and a green and a blue. So you're going in different colors, which are different resistance. So if it's your first time doing it, start with a light band. If you're pretty advanced and you want to create a little bit more of an extra challenge, that's when you can start changing the colors of the band. And again, the great thing about this is that you can do it at home. You don't need to go to a pool or a gym, but you're still working on building the strength of your muscles. Now, I've put this in here because balance is actually very important. And especially if you've had an injury or a bleed into any of your joints in your legs, you need to try and work on balance. Has anyone had a time, again, if you've had an injury and you try to stand on one leg and it just doesn't feel right, you feel a bit wobbly? That's because when you have an injury, your sense of balance gets affected. The fancy word that we use as physiotherapists is the word called proprioception or neuromuscular control. Essentially, it means balance. And when you have an injury, the balance decreases. That's the reason why people still say, oh, my knee still feels a bit funny. It feels like it moves, or it feels like it's pivoting. And that's because the muscles don't have the ability to control the joint and keep it nice and stable. And so one of the really good ways to work on balance is to work on balance. So there are a whole bunch of exercises that people can do. For example, people might like to stand, and again, it needs to be clinical to you. So don't start on the hardest exercise. Start with something that's comfortable for you. So people might start just holding onto the back of a chair and then standing on one leg. Again, you're training balance. As you improve yourself, you might do something like washing your hands at the sink while standing on one leg. And maybe if you're ever into a gym environment, you'll see these things called wobble boards. That's the picture on the screen. It's a balance board. So when you stand on it, the board tends to wobble, but because you're trying to keep it nice and stable, you're working on balance. So balance exercises are actually very important to maintain good joint health, especially if you've had an injury, but also very good to work on as a prevention, a lot of prehabilitation. Now, flexibility means stretching. Stretching is important because you want muscles to be nice and flexible. You don't want muscles to be stiff and tight. And so I encourage a lot of people to do a lot of stretching-based exercises. And remember, when you stretch, it is going to be slightly uncomfortable. And the word that I use is called a comfortable discomfort. And what I mean by that is when you stretch, you might feel a bit of tightness. So if you're stretching your hand, you might feel a bit of tightness along the arm, but as soon as you stop the stretching, the discomfort should go away. That's how a stretch needs to be. And holding a stretch for approximately 20 to 30 seconds improves the flexibility of your muscles. It improves the mobility, and it's also very key to preventing injuries, and especially muscle bleeds and joint bleeds. So if you look at the picture here, you can see a person lying on their back and using a towel to stretch their hamstring. So again, there are a lot of different exercises that can be done to help stretch different muscles of the body. So just going back, why have I talked about all of these things? Why did I talk about hydrotherapy or going to the gym or Therabands or balance-based exercises? The idea here is this: it all comes down to muscle strength. Remember, muscles provide stability and they provide protection to a joint. If a muscle is weak, the joint becomes quite vulnerable. If a muscle is nice and strong and it's got a good amount of control, it protects that joint, it stabilizes the joint, so the risk of a future injury or a future bleed is actually reduced. Now, I've put this slide in here because I see this all the time in practice. It's called the boom and bust cycle. I don't know if anyone has actually heard this term before. Now, we're going to start on the top left-hand corner, and this is what the boom and bust cycle is. You might be having a good day, you're not in pain, there's no discomfort, you're having a good day, and what people generally tend to do is that they tend to overdo it. Because they're having a good day, they kind of mow the lawns, they walk here, they go to the supermarket, they might go to the gym, they do this and they do that, and simply what they've done is that they have unknowingly overdone it. And because you've overdone it, you are in a bit of discomfort. And that flare and pain may take many days or many weeks to settle down. And so once you settle down and you're having a good day, you think, oh, I'm feeling better today. Let me go and do everything. Let me go and do the gardening and mowing the lawns and going to the gym and everything. And that's something that we don't want you to do. That's called the boom and bust cycle. Essentially, it means boom, which means you've done everything all in one go, but then you're bust, which means you're now in a state of discomfort and a bit of pain, and you're really only resting and you're not really being productive for the rest of the days. And so a really good way to try and avoid the boom and bust cycle is, I say to people, is use the 10% rule. Now, if you've forgotten my whole presentation tonight, just remember this number, 10%. 10% is the amount of activity you can increase it by without flaring yourself up. So let's take cycling as an example. And by the way, cycling is a good form of exercise. If someone asked me, or should I cycle or should I walk on a treadmill, I would say to them, if those are your two options, maybe consider a cycle, because the advantage is when you're on a cycle, you're sitting, you've taken pressure off your joints. But because you're moving the pedals, you're now strengthening your muscles without all that gravitational load going in your joint. So I would say to people, maybe consider cycling. But now talking about the 10% rule is, this is how much you can increase it by without flaring yourself up. So let's say you could do a 20-minute bike ride and you want to increase the distance or the time you want to ride. Don't go from 20 minutes to 55 minutes, because that's going to increase some pain and discomfort. Go from 20 minutes and add 10% to the last time. So what's 10% of 20 minutes? 22 minutes. So your next bike ride will only be 22 minutes. You can do it in terms of distance. Let's say you did something like you rode your bike for 4 kilometers and you want to increase the distance of riding your bike. Again, just go 10% more. So 400 extra meters for 4 kilometers. So your next bike ride would be 4.4 kilometers. Use it for hydrotherapy. If you're spending half hour in the water and you want to spend a bit longer, don't go from half hour to 1 hour, just add 10% to half hour, so that you're going to spend around 33 minutes. And this is how you can gradually increase your endurance and your tolerance to exercise. A lot of people give up after once or twice is because what's happened is they've overdone it and they've just done way too much in one go, and you've associated that particular exercise as a bad thing because it strained you, or it hurt your knee, or it sprained a tendon or a muscle. But the thing is, it wasn't the exercise that's bad. It's probably the duration or the intensity that you did it that's caused some discomfort. So by gradually increasing it by 10%, you'll find that you'll minimize the risk of injuries. Now, if you're a severe hemophilic, it's important that you're trying to aim your exercises as soon after you've taken your factor. So I've got this picture here from Takeda, and it's actually from My PK Fit. And if you look at the graph here, for example, on a Sunday, if you've taken your infusion on Sunday, you're now in the green zone, which means that's the time you should be doing some of your more harder exercises. For example, doing something at the gym or going for a swim. But as your factor levels gradually come down, it's important that you're not going to do those harder exercises, but do something that's a little bit more gentle on the body. So whether it be playing a musical instrument or reading a book. So you should be aiming to do your harder exercises in that green zone or straight after you've taken your infusion. Now, there are a lot of apps out there, and again, My PK Fit is an app that Takeda have where you can actually monitor how much factor you have in your body, so you know what activities you can do and what activities you probably want to avoid. Now, I was talking about this, I used this word a couple of times before, a flare-up. So what's a flare-up? A flare-up is when you have an increase in pain and discomfort in your body after you do the exercise. So remember, this is something that's quite common. It's a normal response to have a little bit of discomfort when you do exercise for the very first time. Remember, you're using muscles that you probably haven't used before or in that way or at that intensity, and that's why it's flared you up. Now, it's important that, especially if you're a hemophilic, that you are able to differentiate between a flare and symptoms and a bleed, because if it's a bleed, you need to treat the bleed. But if it's a flare-up, there are many ways and strategies that you can do to try and settle down that flare. And this is where I would again encourage you to talk to your physiotherapist and find strategies that can help settle down your discomfort. Remember what I said before, it's very tempting to give up doing the exercise because people have associated that particular exercise to something that's harmed them. But remember, it's not the exercise, it's the intensity that you may have done it. So if the weight was too heavy, you need to bring the weight down. If the duration was too long, you need to shorten the duration, and then you gradually start to build it back up. So there are many ways to try and manage a flare-up. One of the ways that I say to people is either using a hot pack or a cold pack. Does anyone actually know the answer? Is heat good or is a cold pack good? Well, in my opinion, the answer is actually both. It really depends when you use it. Heat is really good before an activity, and ice is really good after an activity. So heat helps to warm up your muscles. It reduces that muscle spasm. It creates a little bit more suppleness in the muscle. Think about it like a shower in the morning. If you have a hot shower in the morning, we just feel that little bit more looser because heat is a good conductor. It helps to stretch the joint and stretch the muscle. So using a bit of heat before an activity is actually quite a good idea. Now, after you've done the activity, sometimes it's just a bit more flared up. Sometimes it's a bit more sore, and that's when ice is really good after an activity. So it's just about timing these types of modalities. So heat is really good before an activity, and ice is really good after an activity. So I hope I've shown you how physiotherapists can be quite beneficial in helping you with your joint health. Now, I did spend quite a bit of time talking about exercise and the role of exercise, but physiotherapists do a lot more than just the exercise. For example, if you've had a bleed, please do tell us, because we can provide guidance on what to do to manage that bleed, whether it be giving you some crutches or some type of brace or whatever it is that you need to try and take the pressure off the joint. We can help you monitor the bleeds to see what's happening to the bleed. Physiotherapists, we always keep an eye on your joints. If you've seen the physio before, they may have been doing a lot of range of motion tests. They'll be bending your elbow and straightening your elbow. It's because we keep a haemophilia joint health score. So it's a register where we monitor how your joints are progressing. And again, we want to know how your muscles are doing. And it's not just about bleeds. So if you've got any other niggles or sprains, please do get in touch with us, because it's, again, like I said before, prevention is the best treatment. And I put a bullet point up there about bad habits. And talking about habits, does anyone know the #1 reason for ongoing, non-resolving back pain? It's not to do with lifting. The biggest reason for back pain is sitting. Sitting is the biggest reason why people have non-resolving back pain. It's because when you sit, you put the most amount of pressure through your back. And so that's a habit. So again, as physiotherapists, we try and help you change those habits. This is, again, the reason why this whole concept of standing desks have come around. It's not to say that standing is the better position. It's just that we're trying to get you away from that sitting position. But again, as physios, we try and help you with these things. So we might look into your ergonomics and your posture. We look at your activity modification. Can we do something to change how you're doing a certain movement? Here in Hamilton, and I'm pretty sure around the other haemophilia centres, we have a good relationship with the orthotic and the podiatry department, because I strongly feel good footwear is very important. Because think of it like a shock absorber. If you have good footwear, you are now reducing the shock that's transmitted through your joints. So if you need orthotics and podiatrists, your physiotherapist can again help you liaise and navigate that. And again, I've talked about all those other things like your muscle flexibility and the exercise-based therapy and so on. So really, this is the final bit of my presentation. The key message here about good joint health and how physiotherapists can help is all about making sure that the muscles and the joint have regained their strength and they're moving naturally. And so, we try and work with you, and we always ask you, what's your goals? What do you want to achieve? So we can try and help you achieve those goals. We can provide the guidance and the direction for treatment. And again, prehabilitation. So what does that word mean? It's doing something in advance so that we're not doing it after an injury or after a bleed. So if you do come and see a physio and we do see that there's a little bit of muscle weakness or muscle tightness, we can give you exercises in advance so that you are able to better protect your joint. And remember, even though when we give these exercises, it's important that you are implementing this at home. So if we've given you exercises to strengthen your leg or strengthen your shoulders, please do them at home, because that's actually when you see the benefit. The benefit is not when you see the physio, it's the benefit that you get when you go back home and start implementing the strategies that we're giving you. So yeah, well, that is it. So these are the physiotherapists around New Zealand. So people in Auckland, you'll know Kat Pollard. So I'm based in Hamilton. We have a new physiotherapist, Tamsin, who started with us in Palmerston North. I think all of you know Helen Dixon in Wellington, and Lee Townsend is based in Christchurch. So again, I would encourage you to link in with your physiotherapist so that we can work with you and tailor you a good exercise program to try and help you with your joint health. So that is it. I hope that has been useful for you. I hope I've given you some ideas, some tips, things that you can start implementing as part of your journey of recovery. All right, well, does anyone have questions?
There are some questions, Abhi. Thank you very much. That was awesome, fantastic, and what a lot of information. And I wonder how many people set themselves up just a little bit straighter when you talked about their sitting technique. Yeah. Okay, so let's get to the questions. There aren't too many, but there are some. The first comment we had was from Louise, who mentioned that aquarobics is great and available at a lot of pools. And I imagine that's a really good way of getting some low impact exercise into your joints, Abhi.
Exactly. So aquarobics, again, it's doing exercises while standing in water, or you may have heard the term aqua jogging. It's like as if you're running or jogging in water, but when you have an aqua belt on, you've taken gravity out of the equation. So definitely aquarobics is a great exercise.
Yeah. Okay, and the next question from Dani asking what age you'd normally start introducing physiotherapy as a recovery or for strengthening joints?
Anytime. Remember, this at any moment, your muscles always have the ability to get strong. It's about maximizing what you have the potential to do. So it doesn't matter if you're 12 or 15 or 55 or 80. At any age, we can do good, safe, effective exercises that will help build the strength of your muscles. So to answer that question, there is no age. Whatever the age is, it's about maximizing your muscle strength at that moment in time.
So even younger children?
Yeah, look, I think with a lot of younger children, it's more about in that pediatric population, it's about making sure that they're achieving their milestones, that they are crawling, they're rolling over, they're sitting. I think what you'll find in terms of actual exercise is if there is a certain weakness at a certain muscle, and kids can understand why they're doing the exercise, it is safe to prescribe it to them. Again, it's under the guidance of a physiotherapist who can tailor how much to do and how much resistance that they need to do it with.
Great. And the next question is maybe a little tongue-in-cheek from Michael, asking if there's any chance of a 69-year-old learning to avoid the boom and bust cycle by the time he turns 70.
You know, you can always learn at any time. There is no end point. You can learn at any time new strategies and new techniques. I know we're talking about haemophilia here, but at Waikato Hospital, we have a pain clinic, and the pain management clinic is a clinic that's there to educate people on different strategies. And we have a variety of ages of people that will come through, and every single person that has come through the pain clinic has managed to learn one or two ideas and actually start implementing it, and they've noticed some change and some benefit with it.
Yeah, great. Next one from John, asking if there's any other techniques to help with scar tissue damage, and would massages help, for example? I don't know if that's your remit.
Yeah, look, it is a good question, and there are actually physiotherapists who specialize in scar management. So again, so is it John, did you say? If you link in with your local physiotherapist, they may be able to link you in with a physiotherapist who specializes in scar management. Will massage help? The answer is yes. Just make sure that if you are a severe hemophilic, that you're not doing deep tissue massage. The idea is not to bruise yourself, but scar tissue tends to get quite tight, and that restricts your ability to move. So it's about gently starting to regain the movement. So it can't be this all of a sudden vigorous stretching. It has to be a gradual maneuver or gradual way that you're slowly stretching and massaging the joint. But to answer the question, yes, massage would be helpful for scar tissue. Do link in, because there are also other strategies that physiotherapists can do to help with scar management.
Thanks, Abhi. Okay, so Dani wants to know whether you'd recommend preventative physiotherapy to avoid injury, not just as treatment for injuries.
Definitely. That's the word prehabilitation. So preparing. So you may have heard the word rehabilitation, which means something that you do after. But when you do prehabilitation, it's about preparing yourself so that you don't get injured or you don't have an injury. And that's really why physios do a lot of those joint health courses. We're wanting to see how strong are your muscles, how much control do you have, what's your balance like, and so that if we can identify any areas of weakness or any areas of vulnerability, we can implement safe, effective exercises to prevent it. So yes, definitely. Would we recommend preventative physiotherapy? 100%.
Yeah, sounds like a good idea. Hemi has a question. You mentioned hydrotherapy pools of a certain temperature, and would a local public or gym pool usually be an acceptable temperature?
Yeah, look, the temperature is more about comfort. It's because when you're in a hydrotherapy pool, you're not actually swimming, so you're not generating internal heat because you're constantly moving in water. It's the therapeutic effect of being in water that's comfortable, but then doing gentle resistance exercise. But if you don't have access to a hydrotherapy pool, you can still do the exercises in an ordinary pool. Yes, it will be a little bit colder, but I would encourage you to still get into a pool to try some hydrotherapy or to try exercises in water. So would a local pool, public or gym pool usually be acceptable temperature? The answer is yes. If you don't have access to a warm water, definitely do it in the normal temperature water.
Nice. Louise wants to know, or she talks about her son having mild haemophilia, and says that she has a tendency, or they have a tendency to hesitate when deciding if they need to use factor or not, and whether you've got any opinions on that.
Oh, okay. So look, Louise, I would encourage you to get in touch with your local clinical nurse specialist and hematologist, because they can guide you on when the appropriate time it is to use factor. Because if it's a bleed, yes, you definitely need to infuse yourself with factor. Sometimes people may have sprain and then they're unsure, is it a bleed or if it's not a bleed? And if you have a physiotherapist that's, again, a haemophilia physiotherapist that's trained in ultrasound, they can ultrasound the joint or whatever the structure is to see if there is a bleed. Then the decision to infuse yourself with factor is easier. So I think the question, if you're a bit hesitant or you're hesitant not to infuse with factor, please do talk to your nurse and the hematologist, and they'll be able to guide you through that.
Very good. Well, we've got two more questions left. One from Virginia. And again, maybe a bit tongue-in-cheek with this one. Any good tips for motivating your kids that are addicted to Fortnite, etc., when you've tried lots and capital letters with that one?
Look, I mean, it's lockdown at the moment, so I think that's why most people are on. But I think when people understand the value of joint health and muscle strengthening, you naturally get that motivation to do it because you don't want to injure yourself. So look, in terms of motivation, link in with, I think actually link in with your physiotherapist, because if your physio can guide you through to a pool and show you exercises you enjoy, I think the biggest reason why people lose motivation or lack motivation is because it's an exercise that they don't enjoy. And if you don't enjoy something, you're not going to be motivated to do it. So it's about finding something you enjoy. So if you ask your son, what does he actually enjoy? Does he like riding a bike, or is he old enough to maybe go to a gym? And if the answer is yeah, he is, get in touch with the physio so we can try and find something that he actually enjoys. Enjoyment is actually very important. If you don't enjoy it, you won't do it.
Virginia says he's 10, and you know what I mean. So hard to get 10-year-olds to do stuff, it seems.
Yeah, no, I understand.
Yeah. Final question from Robin, who wants to know where to get the coloured bands you were using before from.
Yep. So Robin, all physiotherapists stock these, depending on where you are. You can also buy them. They usually sell them at Kmart, and they're a couple of dollars at Kmart, maybe $5 or something. But if you come to your local physio, we usually have boxes, and we either sell them or just give it to you. So best place to get them is from a physiotherapy clinic. And if you can't get to your local haemophilia physiotherapist, just go to any physiotherapy clinic, because they usually will sell Therabands. Actually,
2 more questions have popped up, and that there are people dying to pick your brains, which is really great. First from Olivia, who has von Willebrands and has some injuries, and wants to know what's the best way to start to help her progress when she doesn't have access to physio.
Yeah, look, so Olivia, it depends where you are. Physios can also do telehealth. So if you do not have access to physiotherapy in person, we are all equipped with telehealth, which means that we can do a Zoom consult like this. We can do phone calls. So depending on what your region is, you can link in with the physiotherapist in that region. So the physios that I've shown you on that list. I mean, it is a good question. What can you do if you don't have access to a physio? I'm a bit hesitant to say to people, go on YouTube or go online, because as soon as you type something, you get the most, extreme things coming up on the internet. I think the answer is try and find a way to link in with the physio. And if it's via telehealth, we're more than happy to help you.
Yeah, Olivia's down South Otago way, and there's not much down there by all accounts.
I wonder, I don't know if maybe one of the other physiotherapists is online. We may have a physiotherapist in Dunedin. So Lee's in Christchurch. I apologize if I've forgotten the name of the physiotherapist in Dunedin, but there is someone in Dunedin.
It's worth Olivia contacting Rosie and seeing if she can progress that to the next step, perhaps.
Yep.
All right, last one from Hemi. Also mild haemophilia, and asking whether or not to use physiotherapy services for preventative therapy. I think you addressed that a bit earlier as well. Yeah, definitely. So definitely that's a goer, Hemi. Prevention is as good as cure, isn't it? Better in some respects.
That's right.
All right, I think that is us. Thank you, Abhi. That was a very good effort and lots of good information there, and I'm sure we all learned a lot. And for everyone who wants to revisit that, it will be available on the website probably next week. Need to figure out how to make that work first. Also remember that there's a survey that'll pop up once we close this up. It's only 3 questions, and it will be really helpful to plan for the next webinar. And on that note, keep your eyes peeled for what that is and when that is, and we look forward to it. So that's the end of that. Thank you, Abhi. Thank you, everyone, and we'll see you next time.
Right. Thank you.